My name is Paige Armosino, and this is Hereditary Hemochromatosis, Part 2. Hemochromatosis is most commonly seen as autosomal recessive, meaning both gene copies or parents have the HFE mutation, which you can see an example of here on the left, that they both carry the HFE mutation, and rarely seen as autosomal dominant, where only one gene or parent has the HFE mutation. So if it were passed on with the autosomal dominant, it would only be from the affected parent. Diagnosing hemochromatosis can be difficult because the early stages or symptoms can be linked to many other diseases or conditions, but the two main methods is serum transferrin saturation and serum ferritin. Serum transferrin saturation measures the amount of iron attached to transferrins, which are little proteins that move iron throughout your blood. And any saturation level above 45% is considered too high. And when a patient would get that result of their serum transferrin saturation being 45 or above, they would move on to the serum ferritin, which measures the amount of iron in your liver to further your diagnosis. Other forms of testing include an MRI, which is an incredibly non-invasive approach to observing iron overload in your body. Another way is liver function testing. Too much iron can lead to damage of your liver. Testing the quality of the liver will help gauge the severity of the disease in that specific patient. Another way is a blood test where they are testing for the specific HFE mutated gene. And probably the most invasive is removing a sample of the liver, which they'll only really do this if they suspect that you already have liver damage. So they need to test the liver itself to see how bad the damage is. There is currently no cure for hemochromatosis, but it can be managed with phlebotomy, which is blood removal. Phlebotomy helps maintain the buildup of iron in the bloodstream. How often and the amount of blood they remove is based off the patient's age, the severity of the disease, and the patient's overall health. And although it's not a cure, it alleviates the symptoms they're experiencing and helps prevent further damage to their body and organs. And there is a video here on the bottom right, where it's people of various ages talking about their day-to-day life with hemochromatosis. And if you guys have any trouble with that link, I'll put it right below as well.